What if the very tests designed to protect your health are actually putting you in harm's way? It's a question that's keeping many healthcare professionals awake at night, and it should concern every senior who's been told that more testing equals better care. The reality is far more complex than that simple equation suggests. Welcome to Elderly Wellness Tips, where we cut through the confusion and give you the honest truth about aging well. I'm here to share insights that could literally save your life, not by encouraging more medical intervention, but by helping you understand when less might actually be more. If you're new here, I'd love for you to subscribe and hit that notification bell. We're building a community of informed seniors who refuse to be passive participants in their own healthcare. Your engagement helps us reach more people who need this information. Today we're diving into 5 specific health screenings that are routinely offered to seniors but may cause more harm than benefit. These aren't fringe opinions. They're backed by growing medical evidence and the quiet concerns of doctors who've seen too many patients harmed by well-intentioned but misguided care. The truth is, medicine has been slow to adapt to the unique needs of older adults. What works at 50 might be dangerous at 75. What prevents disease in younger people might accelerate decline in seniors. And what offers peace of mind to some might create anxiety and complications for others. Let's start with number 1. The mammography dilemma. Breast cancer screening has been drilled into women's minds for decades. Get your mammogram every year, they say. It saves lives, they promise. But after age 75, and especially after 80, this screening can become a medical trap that leads to unnecessary biopsies, surgeries, and emotional trauma. Here's what most women aren't told. The majority of breast cancers found in very elderly women are slow-growing types that may never become life-threatening. These cancers often take 10 to 15 years to progress to a dangerous stage. For a woman in her 80s, that timeline may extend far beyond her natural lifespan. But the moment an abnormality shows up on a mammogram, the medical machinery kicks into high gear. Biopsies are scheduled, surgeries are planned, radiation treatments are discussed. The woman who walked into the screening feeling healthy suddenly finds herself labeled as a cancer patient, facing treatments that can be more debilitating than the disease itself. Consider the story of Martha, an 82-year-old woman who had gone for routine mammograms her entire adult life. At her latest screening, doctors found what they called a suspicious area. The biopsy revealed a small early-stage cancer that was growing extremely slowly. Against her family's wishes, Martha underwent a lumpectomy and radiation treatment. The radiation left her exhausted and weak. She developed complications from the surgery that led to multiple hospital stays. 6 months later, she passed away from pneumonia, her immune system compromised by the treatments she had endured for a cancer that likely would never have harmed her. The American Geriatric Society now recommends against routine mammography screening for women over 75, especially those with limited life expectancy or multiple chronic conditions. They recognize that the potential harms often outweigh the benefits in this age group. This doesn't mean ignoring breast health entirely. It means being strategic about it. If you notice a new lump, skin changes, or nipple discharge, those warrant evaluation. But subjecting yourself to annual radiation exposure and the anxiety of false positives may not be worth it after a certain age. Number 2. The bone density trap. Osteoporosis screening seems like common sense. As we age, our bones naturally become less dense. Testing for this condition appears to be a straightforward way to prevent fractures, but the reality of bone density testing in seniors is far more complicated and potentially harmful than most people realize. The problem starts with how the test results are interpreted. The machines that measure bone density compare your bones to those of a healthy 30-year-old. By that standard, nearly every person over 70 will be diagnosed with osteoporosis or osteopenia. But here's the crucial question. Does having bones that are different from a 30-year-old's necessarily mean you need medication? The answer increasingly is no. Many seniors with so-called low bone density never experience fractures, Meanwhile, the medications prescribed to treat osteoporosis can cause serious side effects, including unusual fractures, jaw problems, and severe muscle pain. Some of these drugs can actually make bones more brittle over time. Take the case of Robert, a 78-year-old retired carpenter. His bone density test showed osteoporosis, so his doctor prescribed a bisphosphonate medication. Robert had never broken a bone in his life and was still physically active. But within months of starting the medication, he developed severe joint pain and had to stop his daily walks. 2 years later, he suffered what doctors call an atypical fracture, a break that occurred with minimal trauma and was likely caused by the very medication meant to strengthen his bones. The most concerning aspect of bone density testing is that it often leads to a cascade of fear-based decision-making. Seniors who receive a diagnosis of osteoporosis may become afraid to engage in the physical activities that actually strengthen bones. They may avoid lifting objects, stop exercising, or become overly cautious about their movements. This fear-induced inactivity can lead to muscle weakness, balance problems, and ultimately, an increased risk of falls and fractures. Recent research suggests that for many seniors, especially those without risk factors like previous fractures or long-term steroid use, the benefits of bone density testing and subsequent treatment are questionable. The tests can create anxiety and lead to medications that may cause more harm than good. A better approach might be focusing on activities that naturally support bone health, weight-bearing exercise, adequate vitamin D, and fall prevention strategies. These interventions don't require testing, don't have dangerous side effects, and can improve overall quality of life. Number 3. The prostate screening controversy. For men over 70, few topics generate as much confusion and anxiety as prostate cancer screening. The prostate-specific antigen test, commonly known as the PSA test, has been promoted as a life-saving tool for decades. But mounting evidence suggests that for older men, this test often causes more harm than good. The fundamental issue with PSA screening in seniors is that most prostate cancers in this age group are slow-growing and unlikely to cause problems during a man's remaining years. The majority of men diagnosed with prostate cancer after age 70 will die from something else entirely. Yet the discovery of an elevated PSA level sets off a chain reaction of invasive procedures and treatments that can devastate quality of life. The journey typically begins with a slightly elevated PSA reading, which leads to a prostate biopsy. This procedure involves inserting multiple needles through the rectum into the prostate gland. For older men, this can result in serious complications, including severe bleeding, infection, and hospitalization. Even when the biopsy is successful, it often reveals cancer cells that would never have caused symptoms or shortened life. But once cancer is found, the pressure to treat becomes overwhelming. Patients are faced with difficult decisions about surgery, radiation, or hormone therapy. Each of these treatments carries significant risks for seniors. Surgery can lead to permanent incontinence and sexual dysfunction. Radiation can cause bowel problems and fatigue. Hormone therapy can result in bone loss, muscle weakness, and cognitive changes. I remember Frank, a 76-year-old grandfather who had been enjoying retirement with his wife of 50 years. His PSA level came back slightly elevated during a routine physical. Despite having no symptoms, he was referred to a urologist who recommended a biopsy. The biopsy found a small amount of cancer, and Frank was told he needed immediate treatment. He chose surgery, believing it would give him the best chance of survival. The operation was technically successful, but Frank's recovery was complicated by infection and persistent incontinence. He became depressed and withdrawn, avoiding social activities he had once enjoyed. His marriage suffered as he struggled with the physical and emotional aftermath of treatment. 2 years later, his oncologist admitted that the cancer had been so slow-growing that it likely would never have caused problems. Major medical organizations, including the American Geriatric Society and the U.S. Preventive Services Task Force, now recommend against routine PSA screening for men over 70. They recognize that the potential harms of testing and treatment often outweigh the benefits in this age group. This doesn't mean ignoring prostate health completely. Men who experience symptoms like difficulty urinating, blood in the urine, or pelvic pain should seek evaluation. But subjecting asymptomatic older men to routine screening can lead to a cascade of interventions that may shorten rather than extend life. Number 4. The colonoscopy concern. We've touched on colonoscopy screening earlier, but it's worth examining this issue from a different angle. While colonoscopies can be valuable for detecting colon cancer in younger adults, their role in seniors over 75 is increasingly questionable, particularly for those who have had previous negative screenings. The procedure itself becomes riskier with age. The bowel preparation required before a colonoscopy can be dangerous for seniors, causing dehydration, electrolyte imbalances, and kidney problems. The sedation used during the procedure can lead to confusion, falls, and breathing problems in older adults. The physical stress of the examination can trigger heart problems or blood pressure changes. But perhaps more importantly, the time horizon for benefit becomes questionable. Colon cancers typically develop slowly over many years. For a 75-year-old with no symptoms and previous clean colonoscopies, the likelihood of developing a life-threatening colon cancer in their remaining years is relatively low. Meanwhile, the risk of complications from the screening procedure itself increases with age. Consider the experience of Dorothy, an 80-year-old woman who had undergone colonoscopies every 10 years since age 50, all with normal results. Her gastroenterologist recommended another screening, citing the importance of continued surveillance. Dorothy agreed, trusting her doctor's judgment. During the bowel preparation, Dorothy became severely dehydrated and had to be hospitalized. The colonoscopy was postponed, but when it was finally performed 2 weeks later, she developed a rare but serious complication: a perforation in her colon wall. Emergency surgery was required, followed by weeks of recovery and a temporary colostomy. The screening that was supposed to protect her health instead resulted in months of suffering and a permanent change in her quality of life. The American College of Physicians now recommends against routine colonoscopy screening for adults over 75, especially those with limited life expectancy or serious chronic conditions. They recognize that the risks often outweigh the benefits in this population. For seniors in this age group, attention to symptoms becomes more important than routine screening. Unexplained weight loss, changes in bowel habits, blood in the stool, or persistent abdominal pain warrant evaluation. But in the absence of symptoms, the risks of colonoscopy may be too high to justify. Number 5. The thyroid testing trap. Thyroid function testing might seem harmless. After all, it's just a simple blood test, right? But for seniors over 70, routine thyroid screening can open a Pandora's box of unnecessary treatments and dangerous interventions that can significantly impact quality of life. The problem begins with how thyroid function changes naturally with age. As we get older, our thyroid hormone levels naturally decline slightly. This is a normal part of aging, not a disease that needs treatment. However, many doctors interpret these age-related changes as thyroid dysfunction and prescribe hormone replacement therapy. Thyroid hormone replacement in seniors can be particularly risky. Older adults are more sensitive to thyroid medications, and even small doses can cause dangerous side effects. These include rapid heart rate, irregular heartbeat, anxiety, insomnia, and bone loss. For seniors with existing heart conditions, thyroid medication can trigger serious cardiac events. The situation becomes even more complex when we consider subclinical hypothyroidism, a condition where thyroid hormone levels are slightly low but not dramatically abnormal. Many seniors are diagnosed with this condition based on routine blood tests, even though they have no symptoms. Treatment of subclinical hypothyroidism in older adults is controversial because the benefits are unclear while the risks are real. Let me share the story of Eleanor, a 73-year-old retired teacher who felt fine until her annual blood work showed slightly elevated thyroid-stimulating hormone levels. Her doctor immediately prescribed thyroid medication, explaining that it would help her energy levels and prevent future problems. Within weeks of starting the medication, Eleanor developed heart palpitations and couldn't sleep. Her doctor adjusted the dose several times, but she continued to experience side effects. Over the next year, she was hospitalized twice for heart rhythm problems that doctors eventually linked to her thyroid medication. When she finally stopped taking the medication against her doctor's advice, her symptoms resolved, and she felt better than she had in months. The challenge with thyroid testing in seniors is that symptoms of thyroid dysfunction, fatigue, depression, memory problems can be caused by many other factors common in older adults. Treating the thyroid numbers without considering the whole person can lead to inappropriate therapy that creates more problems than it solves. Many endocrinologists now recommend against routine thyroid screening in asymptomatic adults over 65. They recognize that the potential for harm often outweighs the likelihood of benefit, especially when treating mild abnormalities that may be normal for that person's age. If you're commenting along with this video, let me know which of these 5 screening tests surprised you the most. Your engagement helps us understand what topics resonate most with our community. The path forward. The common thread running through all these screening dilemmas is the need for individualized, thoughtful healthcare that considers your unique circumstances, values, and goals. The one-size-fits-all approach that dominates modern medicine simply doesn't work for seniors who have complex health needs and limited life expectancy. This doesn't mean abandoning healthcare or ignoring symptoms. It means being strategic about medical interventions, asking tough questions about potential benefits and risks, and making decisions based on what matters most to you. Sometimes the most courageous choice is saying no to a test or treatment that everyone else assumes you should want. The medical system has been slow to adapt to the realities of aging. Many doctors continue to apply guidelines designed for younger adults to seniors who have different risk profiles and different priorities. As patients, we have the right and responsibility to question these approaches and advocate for care that truly serves our best interests. Living well after 70 requires wisdom, not just medical intervention. It means understanding that not every abnormal test result needs treatment, not every risk needs to be eliminated, and not every medical recommendation is right for you. The goal is not to live forever, but to live well for as long as possible. Your body has carried you through decades of life. It deserves respect, not endless testing and intervention. Trust your instincts, listen to your symptoms, and remember that sometimes the best medical care is the care you choose not to receive. Thank you for joining us today on Elderly Wellness Tips. We hope this information helps you make more informed decisions about your health care. Remember, being an informed patient means asking questions, understanding risks and benefits, and making choices that align with your values and goals. We'd love to hear from you in the comments below. Share one insight from today's video that you found most valuable, or tell us about a time when you questioned a medical recommendation. Your stories help build our community of informed seniors who refuse to be passive participants in their own healthcare. If you found this video helpful, please like it and share it with someone who might benefit from this information. Your support helps us continue creating content that empowers seniors to make wise healthcare decisions. Don't forget to subscribe and hit that notification bell if you haven't already. We're here to provide you with the honest, evidence-based information you need to age well and live on your own terms. Thank you for watching, and we'll see you in the next video where we continue our mission of helping you navigate the complex world of senior healthcare with confidence and wisdom.